morning, Trudy,
Good morning.
Christian. Unfortunately, Jacinta is supposed to be with us, but she had prior engagements, and we may be expecting her, or maybe based on the time, she may not be here. But in
Mhm.
any case, the show goes on. Trudy, good morning.
Good morning, Carlton. Good morning. Good morning to the listeners of Q95 and, of course, our regular listeners of Jolly's Health Vibes who are logged on every Wednesday morning. Good morning to you. Carlton, I missed you. We were not on live last week.
Yes.
So, I have gotten so used to this Wednesday health vibes rendezvous,
I know.
with Mr. Langdo. So I missed you, and it was your birthday
It was
last
my birthday
week.
last week.
So happy
Yes,
belated birthday
yes,
to you. I know it's the start of June.
yes.
So you started up the month
Yeah, I haven't
with
heard.
a birthday.
I have not heard a Hurricane Carlton as yet. Being
Ah,
born 1st of June,
ah.
I would be. It would be very interesting to know how that name would be manifested.
Ah, I don't think I don't know. It might the name Carlton. I suspect it wouldn't be that bad. It might be a storm that just stays in the sea, doesn't hit land. But we don't want to. I don't want to think about any storm at
Yes,
all.
I
So
know.
yeah, the heat is concerning. I know a lot of people are like myself concerned that it is the
Hmm.
hurricane season, but even prior to the commencement of the hurricane season on June 1st, the temperatures had
Yes.
already started to get
Hmm.
overwhelmingly high. And we know in this region that high temperatures and warm waters
Hmm.
are the perfect, the perfect
Environment.
environment
Hmm.
for storm development. So,
Yes.
it's a little concerning, just trying to stay positive and prepared this hurricane season. But the temperatures are concerning to me.
Hmm.
Hmm.
Yeah, and I do feel so, I feel oftentimes sorry for the cattle, the sheep, the goat,
Yeah.
you see them sometimes chewing on this grass, dry grass, and you don't see any water close by. We want to remind the farmers and the caregivers or takers of these animals that it's important to give them water. Don't wait for when they get home to drink water, but at least where you tying them, put something with some water for them. It's not nice to see them out there tied
Yeah.
and there is no sight of water close to
Yeah.
them.
Yeah.
So remember that they need water as we do need water as well.
Hmm.
Trudy, was it last week? No, week before was the clinic. We had the clinic.
The
Yes,
Women's Reproductive Health Clinic, Sexual and
right.
Reproductive Health. It was
Yes.
May 24th and 25th.
Okay,
So that's,
great.
yeah, like two
So
weeks ago.
that was a huge success.
Hmm.
We already having names for the next one. People already submitting their names for
Ah.
the next one. I really want to say that I really applaud the public for all this trust in the initiatives of Jolly's Pharmacy and recognizing that we truly care for you. We care for you, and we show it, we demonstrate it. Optimizing your general health and wellness is our mantra, and we always are happy when we present something to you, you trust it, and you actually receive it. So I want to
Hmm.
thank Ms. Proctor and Ms. Rosie Felix, who were awesome
Hmm.
in real consummate professionals. I think most of these women, they would have maybe gotten some information or learned something during the process
Hmm.
that they had never known.
Hmm.
And a lot of them were like, wow, for years I've been doing pap smear, no one never told me XYZ. So they
Right.
were educated by the senior retired
Hmm.
nurses, and they felt very comfortable when they saw these nurses.
Right.
Where I know Nurse Rosie Felix, I think she ended at after 7 that
Oh,
night
wow.
when she
Okay.
did the first her clinic. Nurse Proctor as well did excellent. So I want
Hmm.
to really thank these nurses, Dr. Lisa Jolly, who was there as well as a support, Lafales Lab, who actually did not charge us no money for testing the slides.
Okay.
And so
For
last
reading the slides.
Lafales,
Nice.
huge Andre.
Fortune.
Yes, we really want to thank you, Andre Fortune, for seeing the need for this and collaborating with us. The Cancer Society, Miss
Mhm.
Yvonne Alexander, for really again supporting us. My assistant, Leona Jeremiah, for really facilitating this. I mean, she was the hands-on person behind the scene that
Okay.
did all of the logistics for this. And Miss John Baptist, that's Dr. Lisa Jolly's secretary, as well for assisting. So this was a really good clinic. I think all of your test results will be sent to Dr. Jolly, and they will give you a call once they have received it. And if there is a referral, they will be referring you to an OBGYN as well. So we really want to thank you for such, participating in this. This is really a good thing. Let me say too, from a personal standpoint, that I really want to thank the many people who prayed for my mother during her illness. She's still hospitalized, but is doing much better. Those of you who may not have heard, my mother had a stroke, and so hence I wasn't here last week.
Mhm.
I had taken the entire week off. She's doing better now, and we just pray for a complete healing and recovery.
Mhm.
So all my good friends and many people who met me, and really, I mean, almost every church in Dominica was really praying for my mother. I mean, I had people say they were fasting, and
Mhm.
so that really meant a lot to me, because it
And
was a
it
very
matters.
difficult time
Yeah.
for our family. It was
Yeah.
very difficult at that
And
time.
support is
It
definitely
is.
important
It
at
is
these
very
times.
important.
Yeah.
And
Yeah.
I should say to Trudy, that my mom has received incredible
Care.
care
Mhm.
at the
Dominica
Dominica
China
China
Friendship
Friendship Hospital
Hospital.
from
Yeah.
since she got in that early morning. The first doctor who dealt with her was very accommodating, very communicative. She told us everything step by step what was happening. All the preliminary tests were done, including CT scan. Then she was warded. Again, the specialist came. The specialist worked even on Sunday and the holiday, because there was a
Mhm.
holiday as well. And so I really want to thank them for giving her really good care.
Mm-hmm.
Yes.
And it's good, Carlton, to compliment and that
Yes.
you had a positive experience thus far. And I continue to pray for her. And I know I saw the outpouring of love and support
Yes.
for your mom on your social
Yes.
media, and it's a good sign. You know, we are a supportive community. Sometimes we can be, and it's good to see that support being poured out in
Definitely.
this situation.
All
Yeah.
right. So what we're going to do, we are going to take a short break, and then we will introduce our guests this morning and the
Mm-hmm.
topic that we are going to discuss. But I will let you know it is a very relevant topic. It is one that will impact every one of us. We have the expert in the house today. We want you to listen, because you may not, there may be misconceptions that you have. You may have someone who is experiencing one of the conditions that the specialist will be talking about, and you may need to be able to inform in a constructive manner the information to that person. So we're going to take a break, and then we'll be right back.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Lango with co-hosts Jacinta Fagan Defo and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
I woke up this morning feeling real stink. I had the intentions to call in sick, but I end up in Jolly's pharmacy. Great and down King Street, Jolly's fix some my immune system. Got me feeling fit and strong. Now I'm ready to work and pick on any mission. If you see me walking, Jolly's pharmacy is number one. Jolly's walking. We cater for everyone. Jolly's walking. Boost up the immune system. Jolly's walking. Yeah. Yo, Dominic is the boy Father Fox. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy. They boost me up real quick. Jolly's Pharmacy, leading the way in healthcare.
And we are back with you. Of course, this is Health Vibes. And as Mr. Lando promised, we have a very special guest in studio with us this morning. And she is no stranger to Health Vibes. She's been with us before. As a matter of fact, one of our previous episodes of Health Vibes where our guest was with us was played last week. So you maybe, listen to that episode and you heard her quite recently. So in studio, we have with us Dr. Nadia Wallace, who is the consultant psychiatrist at the acute psychiatric unit at the Dominica China Friendship Hospital. And she has graced us with her presence today to share, her wealth of knowledge with us on handling mental health disorders. So that is our topic, and that is something I'm sure that the listenership will be very interested in learning and understanding. So Dr. Wallace, good morning to you.
Good morning. Good morning, Judy. Good morning, Halton.
Good morning, Dr. Wallace.
It's a pleasure being here, as always.
Happy to have you on.
And good morning to all the listening public.
Yeah. Actually, I just want to say too, even last week was a very overwhelming week for me. And there was a moment where I was sandwiched with a lot of pain, around me. And I called her and I said, Dr. Wallace, I'm going through, there is just so much, of sadness around me, and my kids are crying and this and that happening. Sometimes we I mean, she's my friend and I have a personal number, so I can, but it really means that many of us will be faced with overwhelming situation, and we just need to call a little lifeline, and that's what we're going to talk about. We're going to really talk about coping with mental health disorders, coping with stress, coping with the stresses of life. Sometimes that can really be overwhelming, and many people are experiencing hardship that's affecting their emotional and mental cognitive health. Many people cry in silence in the pitch of midnight. They watch the ceiling and they can't sleep and they're crying. Sometimes they get palpitations, they feel anxious, they have to go to the bathroom many times, and many people are experiencing these types of symptoms now, and they may think, well, they know it's abnormal, but yet still they may not want to accept the fact that it's something that may be medical, that requires intervention. And they tell themselves it's going to be better. Some people pray and they pray, which is great, and even sometimes when they pray, they still don't necessarily get they don't feel better so quickly. And so this morning we have Dr. Wallace. Dr. Wallace is someone that I respect very highly in her field. And Dr. Wallace, you would have heard me characterized in a nutshell many of these feelings that many people are experiencing now. What does it symbolize? What does it say about what that individual might be going through? And how do they cope? And how do they recognize when it's too much to seek health intervention?
Carlton, I was just listening to you, and in my mind it's like, wow, so many times we have these symptoms and we don't recognize them for what they are. We don't recognize them as symptoms of a mental illness, because the perception out there of mental illness is so different from what it really is.
Right.
We think mental illness, we think psychosis.
Mhm.
You know, we think, and I always say that, you hear me say that all the time.
Mhm.
The person who is out there looking like they don't know what they're talking about,
Mhm.
they might be agitated, looking like they're just not in touch with reality. And that's all we think of. But
Mhm.
this is so wrong.
Hmm.
Mhm.
According to the diagnostic DSM-5, the Diagnostic and Statistical Manual of Mental Disorders, there are close to 300 conditions that we can consider mental illnesses. So
So
what
in a
is
sense, every one of us has one.
so I always, and we can get one, at least one, sometimes more than one,
Yeah.
Mhm.
that we can
Wow.
Diagnosed.
remind
Mhm.
us, that we can be diagnosed of. So it's real out there. We need to recognize mental illness is not just that. So when we have those symptoms, we need to stop and pay attention to them. And every one of them is different. Every one of them require a different management.
Mhm.
You understand? And the majority of the conditions don't require admission. They don't require any pharmacotherapy. You understand? But people don't think that most of the times. And when it comes to treating a mental disorder, in other words, we have to know, it all depends on which mental disorder we suffer from. It depends on the intensity of our symptoms, and it depends on ourselves, what works for us, because everybody is different. What may work for you, what may work for me, it's not the same. And a lot of times I get the question, Doctor, what causes my condition? What caused this mental illness that I suffer from? And I always say, when it comes to mental illness, it's not about cause and effect. We focus on risk factors. We have to focus on the risk factors. So there are biological, psychological, and social determinants of mental illnesses. In other words, you have biological risk factors, psychological risk factors, and social risk factors. So in treating a mental illness, you focus on those factors to treat the mental illness.
So it's not about maybe I ate a particular meal that could cause me to get mentally ill. But those are very, very valid points.
And yeah, no, I was just happy, Dr. Wallace, that you're categorizing these risk factors and the terminology, the correct terminology being used, because I know a lot of people may worry or say, why would I be someone to suffer from a mental health disorder or mental illness? Almost like, I am capable, I am, yes. And then you categorizing the risk factors as biological, psychological, and social. Or I guess we could in social we could also think of environment. Yes,
that's
environmental.
exactly.
So it's not like it's a person is too good or too capable or too well informed to suffer from a mental health disorder. So I was just happy at the categorization of the risk factors, so people can understand that we can all be exposed to risk.
Right. So just to go a little further, to help you or help our listening public also understand, when we talk about the biological factors, like the biophysical factors, we focus on our family history of mental illness or mental disorders. If you have a family history of mental disorders, you are at a higher risk yourself of suffering from a mental disorder. It doesn't mean that once you have a family member who has mental illness that you are going to, neither does it really mean that without a family member you are not at risk. We also focus on things like your birth, the pregnancy history, and what happened after birth, because you can have insults at those times that could cause damage to the brain. If you have a traumatic brain injury, also things like substance use, all these fall under biological risk factors that can predispose one to suffering from mental disorders, a mental disorder. among the psychological risk factors, you have things like traumatic events. If somebody was raped, you understand? And the way we think of, the way we solve our problems, our self-esteem, the way we manage stressors, all these fall under the psychological risk factors. And then the social, you have things like things that happen in your environment, even in your relationship, the way you relate in relationships, and how things are between you and your partner. You also have things like your friends, recent job loss or loss of someone,
Relationship.
loss of a loved one, shifting to a new environment and not being able to cope with it. You understand? And all this bullying at the children, bullying at in primary school, even sometimes at
Social
high
media.
school. Understand? And you have poor social skills and poor communication skills. All these things, when you are discriminated, all those things, discrimination in your society. So all these factors increase one's risk of suffering from a mental illness.
So, Doctor, I'm really liking the way that you are relaying the information to us. There may be someone who is experiencing some of what we're talking about, and they have told themselves, well, I'm just going through a phase, or that's maybe might even blame the weather and say that it's been so hot. Maybe that's why I'm feeling that particular way. And because, again, of the stigma and discrimination that is associated with mental health disorders, this individual may choose not to seek help. How do you encourage that person to look within themselves and find or get that courage to access help?
So, Carlton, the very first thing we have to recognize is how I started, by educating ourselves and recognizing that a mental illness, having a mental illness, could be any one of these conditions. As I said, there are almost 300 conditions categorized in about 20 different groups. And you have things like sleep disorder and eating disorder. You have the mood disorders. You have the psychotic disorders. You have the depressive disorders. You have the anxiety disorders. You have the psychosexual dysfunctions. You have the neurocognitive disorders. There are so many of them that are considered. So we have to recognize, first of all, that what you have is a mental illness, and it doesn't mean that you are psychotic. There are very few of these conditions that have psychosis, meaning when you lose touch with reality. So we need to recognize, and I'm really hoping that people can really have an open mind to this and see this for what it is once and for all. We need to educate ourselves. We need to be made aware that mental illness is broad. And we need to we as we get older, we learn all the time. You understand? And with learning, we should expect change. So you may have the misconception that mental illness is this, but if anything, at least, if not before, at least this program, this time, stop and say, really, okay, I thought it was that before, but no, I'm being educated now to understand that it's not just that, it's more than that. So when I think of mental illness, I'm not going to think of how I used to think of it before and feel about it before. Recognize that these are signs and symptoms and feel comfortable. Once you have a different understanding, a different learning, you're sensitized, it will be much easier for you to come forward and try to get help. So that is the first thing we need to recognize. And secondly, very importantly, we need to recognize that having a mental illness and not managing it, it's going to put us at risk in every aspect of our lives.
I was just going to get into that.
Every aspect of our lives, because we need to have good mental health for us to do everything that we have to do. Everything. to eat, to get dressed, to go to work, to relate with each other, be it our spouses, our
Yeah.
colleagues at work, to anything, to make decisions, everything. It is determined by your mental health. If you don't have good mental health, those things will not happen as they're supposed to. You will not be as productive as you're supposed to. You'll not be able to manage your daily activities as you're supposed to. So it is so important that we stop and pay attention. And so when we have the symptoms, we get help. It's something that can be managed. It's something that can be treated. So we really need to try to just change this mindset and have a different mindset when it comes to our mental health.
Dr. Wallace, I wanted to follow up on this aspect, getting help. Some of the disorders or the categories of disorders you mentioned, people may feel, or the in actuality are pretty common. Depressive disorders, anxiety disorders, for instance. And people may feel, okay, I can get myself through this, as you call it, a phase. Some people refer to it as a phase. What is the outcome if someone never someone does have a mental illness but doesn't receive help or feels that they have overcome it just on their own? Is there what is the
Actually, the truth is, as I said at the beginning, how you manage it depends on the intensity of the symptoms. So
Okay.
different degrees, different levels.
Okay.
So you may have mild, moderate, or severe mental illness, right? And depending on which category you fall in, that will determine what management
you need?
you
Okay.
need. So sometimes it may just be psychotherapy that's required if it's just mild symptoms. And as you said, sometimes you can get better in time, but what happens when you don't get help is like the symptoms are prolonged. In other words, it takes much longer to resolve than if you'd gone to get help. The symptoms would have gone away much earlier, and your functioning would be restored much earlier. You'll be more productive. And another thing, if people don't manage the mental illnesses, what's going to happen is that you're going to have worsening. The prognosis is going to be worse. You're going to have deterioration, of the condition. So it's better. It's just like all the other conditions,
Yes.
prevention and promotion, where we start to capture it from very early. And from very early, we get into it, we have intervention to manage it. It's the very same thing.
I wanted to, because I think it really much synchronizes where Trudy is, the question that she asked you, because in terms of coping and recognizing there are many people who may have gone through that and never resorted in seeing a psychiatrist or even a primary healthcare doctor. And you would find that they are more prone to getting something to help them. So it might begin with 2 glasses of wine, then an entire bottle of wine, then
weed.
maybe some marijuana, and then it progresses deeper and deeper, and they will tell themselves that is what helped them. Give us some, because I know you have dealt with a lot of drug-induced psychosis as well, and all of this, the different aspects of that.
Right.
So tell us about self-medication, and because a lot of people do that, they might come to the pharmacy, pick up something over the counter, sleeping aid, or something that's going to get them drowsy, just to kind of get that resolution that they're looking for.
So, Carlton, what you said is so true. Many times, someone may have a mental illness and they try to cope with it in the wrong ways. They use wrong coping methods, and those methods that they use then precipitate other conditions. So, for example, you may have difficulty. Some people may say they don't feel relaxed, and to help them to relax, they'll smoke a weed, they'll smoke a joint. And when they do that, they feel calm, they feel better. Some people self-medicate on alcohol, as you said. But then the marijuana that they use. Remember, I mentioned that every one of us is different. Some of us have higher risk of suffering with mental illness based on our biopsychosocial factors, right? So marijuana is one of them. It falls under the medical, where by using marijuana, that may precipitate substance or marijuana-induced psychosis in someone who is at risk. Someone, for example, who has a positive history of mental illness, if they have family history of mental illnesses. Also, a young person. The person is young, the brain is still young, and it's still developing. So then it can get insults from the marijuana use. So you're trying to solve one problem, but you're producing another problem. With the alcohol, alcohol is something that is legal, but this is something that causes serious problem, and you can have mental illnesses, as a result of this. One of the risk factors that can predispose one to suffering with a mental illness, because when you have alcohol over a period of time, we have things like alcohol-induced psychosis. You can go into withdrawal. You can get delirious as a result of alcohol. And that's talking about the psychiatric complications. Do not forgetting the social,
Physical and the-
environmental, and medical
Physical.
complications that you can have from alcohol use. So you see, you use the alcohol to try to solve one problem, but you get so many other problems as a result. And that's just the symptom, trying to cope with a symptom of a mental illness. You understand? So you may be saying that you feel restless, or your thoughts are just racing, and you use marijuana to try to help you to relax, not realizing the racing thoughts, the restlessness, the talkativeness are signs and symptoms of a bipolar disorder that can be managed with a mood stabilizer. And that's all you need, and you not have to go, you understand? But instead of recognizing that, you use marijuana, that now go and precipitate it to worsen the condition, the problem, and you end up getting something like marijuana-induced psychosis. So many times that happens.
So doctor, what you're saying is, it makes, I never even looked at it that way, but it's really deep. So what Dr. Wallace is saying is that many times you as an individual may have the disease, the disorder already, and you don't know. By using the substance, you are actually making the disorder worse, and you might be creating even another
Further
disorder.
complications, yeah.
Wow.
Yes. So this is something. So we need to really pay attention to those things. It's wow. Especially now, Carlton, it saddens when I hear, especially young teenagers, young children, young people, then they say to me, "Oh, marijuana." What they tell me, it's legal. We know that it is, it's
Yes,
but they say
Decriminalized.
it's legal.
Yes,
It's and that means I can use it now. And they'll say, but so many people, I know so many people who use marijuana for so many years and nothing happens with them. Nothing happens to them. So that is not causing any problem. It's not that, and they say, I cannot stop using it. I will continue to use it. So this is just one of the problems, Carlton, that and truly that we have. But as I said, we have since the pandemic, major depressive disorder and anxiety disorder have become the most prevalent mental disorders. It has increased by over 30% since the pandemic. So a lot of people are have symptoms of major depressive disorder and symptoms of anxiety disorder. I'm seeing so many people coming to me with those. And both depression and anxiety, they can be debilitating. Anxiety can prevent you from functioning at work, at school, just even socializing. You understand? It can. But these are the two most prevalent mental illness presently. And when it comes to, so with all that said, when it comes to treating a mental illness, it's important that when you see your doctor, you let them know of all the signs and the symptoms that you're experiencing. Be honest. Don't lie about your symptoms, or don't withhold some of them. You remember I mentioned about your psychological risk factors, your abuse, if there is those things also, they can interfere in whatever you see, the presentation, or they not interfere, but they can influence, the presentation that you see in front of you. Because a lot of times we see people with behavioral problems and we focus on the behavioral problem. That person is behaving this way, not recognizing that behavioral problem is not that. You need to find the root of that problem. When you probe into that person, you will see so many conflicts that that person is struggling with. And because they're unable to cope with it, it's manifested with those behavioral problems.
So, Dr.
I have
Wallace,
some.
I know you quickly. Yes, we do have general practitioners who will see patients like that. Usually, they will access the general practitioner even before. At what stage do you believe that the general practitioner should refer the person to see the psychiatrist? Because sometimes you find general practitioners will take on their own and navigate and use this or use that and that type of thing, and may not necessarily refer the patient to see the psychiatrist.
Well, in Dominica, we always boast of our primary healthcare system. We have one of the best in the Caribbean. And one of the, we've been trying to, but I'm hoping after this program, it will sensitize the public more and get them to understand that they can present to the district, the health center, to the district medical officers if they are experiencing any of these symptoms. Because just like any other medical condition, the primary healthcare system, it's there to treat mental illnesses, right? So if anyone is experiencing those symptoms, they can present to those health centers. The doctors there will review them. And if they need, so a lot of times by just speaking to some, they may not necessarily require specialized care. The doctors in the district may be able to help them. But if they recognize that they really have serious impairments in their functioning, that is when they will be referred for specialized care.
I have several questions, but let me ask you two, and then we will see how that progresses. The first one that came up to me, Dr. Wallace, when you were speaking of coping and some of the things that people use to cope, inclusive of alcohol use, or marijuana use, or drug use. What about people who may cope with mental illness with a behavior or with a strategy that other people may feel is positive, such as exercising, or channeling their attention solely into something that maybe society would deem as positive work, yes, or as I mentioned, exercise. I wanted to talk, and I wanted to get your feedback on that aspect of coping, coping that maybe society sees as that's a good thing, the person is working more, the person is going to the gym more, that. And then I wanted, as we were speaking of symptoms and telling your health practitioner symptoms, the two major, or the two disorders or categories that you're seeing so frequently, major depressive disorder and anxiety disorder. What are some of those symptoms that we should be mentioning? Because I have seen so many people say, "Oh, that's not everybody." When they're speaking about things that I know is a symptom, but they figure everybody is like that. It's nothing. So I just wanted to, get those symptoms down.
Before Dr. Wallace answers, let's just take this caller firstly.
Sure.
And see. Good morning to you, caller. Thanks for calling.
Hello, morning everybody.
Good morning to you, miss.
Very good program.
Thank you.
But I want to ask Dr. Wallace a question. She mentioned all the different, mental disorders and so on. Now, what I'd like to ask is somebody come to you and tell you about, when they speak to you, this is causing me that maybe I'm abused at school, probably my promotion at work, I'm not getting it, they gave it to somebody else, or, something like my father. It's this type of thing, right? Or the abusing, as I said, abusing you at school, or any other form of abuse in any form. I was supposed to get this house, they gave it to that person that's bothering me and so on. my supervisor is always on my back and so on. And so on. What do you, as the doctor, when the person tells you all these things, do you intervene or I'm just asking, would you go to the person who is involved and say, well, look, she said you, she said you're abusing her, but you're speaking too hard at work. What is the problem? Koda. Do you intervene in that way? Thank you.
Okay, Kola. In situations like this, the important thing is empowering that person to scenario that you presented, the condition, this mental illness that that person may present with, it's called adjustment disorder. And it may be manifested with depressive symptoms. It may be manifested with anxiety symptoms. It may be manifested with behavioral symptoms, or it may be manifested with a combination of behavior and mood symptoms. Okay, but so in situations like that, it requires psychotherapy, and in other words, talk therapy and helping the person, empowering the person to be able to cope with whatever situation that they're being faced with.
Okay. Good.
Thank you.
So Judy,
Yes,
what-
yes. The
Hopefully you
question
can
of this,
remember.
the positive coping
Yes.
mechanisms,
Yes.
and the question really symptoms.
Mhm.
Yes.
So before I answer this question, some of the treatment, the ways that you treat mental illness, as I said, there are different ones. So the most common treatments you find are the antidepressants. You have the anti-anxiety medication. You have the antipsychotics. You have the
Mood stabilizer.
mood stabilizers. These are the four most frequent, medications that you use. And of course, I said psychotherapy already. This is one of them. So remember, everyone requires a different management based on the condition. And if the condition is very mild, in addition to that, your lifestyle is important. So your diet, the relaxation methods like exercise, that's one way one of the things that you can do. Your sleep is very important. It's also very important to have good social relations. Reach out to family members, reach out to a support system, communicate with them. You understand? So these are some of the things. So Judy, to answer your question, this is one of the positive coping methods to manage a particular, it could be anyone. If it's a mild depression that you have, or even anxiety, exercise can help in the management of those conditions.
Okay.
But I think what Trudy was trying to say is if you are
Like you over-
masking it. So, for
Yes.
example, you are suffering with one of these disorders, but you're spending way more time in the office because you feel that it's somehow it helps you, or you
Yeah.
spend way more time playing dominoes or watching football or running, but then it's
Yes.
like a mask.
So
How do you know?
Yes.
Get
That's
that's
no.
No.
Recognize it's something.
no, you may mask it for so long.
Mm.
Okay. Yes, that may be helping you, but there may be other signs and symptoms that the person will be presenting with that whatever they do, it may not be able to resolve.
okay.
You understand? It may resolve one aspect of it, but not all. Remember, when it comes to disorders, it's not just one symptom, it's a combination. So that's the playing and staying. Working excessively or playing another game, it may help you to feel relaxed. It may help you to feel productive and prevent you from going. Let's say if you have some problem at home, right? A relational conflict. And to move away from it, you spend more time at work. You go out with your friends, you don't go home as much. It helps you because it removes you from the environment. But when you get back to the environment, the problem continues.
Yes.
Everything, it just weighs right back on you. You understand? So it may be temporary, just in that specific situation, it may help you, but it's important to manage the entire.
That makes a lot of sense.
You understand?
That makes a lot of sense.
Yeah.
Let me just give the numbers again: 449-3095, 449-3096, 449-3097, 616-4257. And if you'd like to call us from overseas, you're welcome to do so. That number is 305-432-9624. Let's take this caller. Good morning. Good morning to you, caller. Thanks for calling.
Hello, I'm sorry to call back again, but Dr. Wallace, what I was trying to get from you, after you get all the persons to speak to you about, what is causing them to be in that book, what I was trying to get from you, would you, I'm just asking, would you, as the doctor, say, for example, go to the workplace, it is, say, for example, I'm a supervisor, right? I'm shouting at my employer, whatever, my subordinate, and that's affecting the person. What I was trying to say, would you now go to the office and speak to that supervisor and say, well, look, my client came to me, that my patient is there with me, and this is what she told me, and this is affecting her work. So that's what I was trying to find out. Would you, as the doctor, intervene to speak to that supervisor to see if that supervisor would kind of, change their attitude and their form of supervision? That's it.
Okay.
That's ethics.
All right. So let me see. I will intervene with you. And I'll say that again. I can intervene with you. As I said earlier, I will empower you so that when you go to work, you'll be better able to cope with whatever problem you're faced with at work with the supervisor. But going to the supervisor, no. After I work with you, you'll feel much better and you'll be better able to deal with the situation at work. So that's what I mean when I said I would empower you. However, if the patient, I have situations where patients are admitted to my ward, and if one of the stressor in their life, if something at work, sometimes we do call in family members and whoever it is, and we do try to intervene in that regard for that person. So yes, this happens if the person is admitted on my ward. It's part of the intervention. But if I'm seeing someone privately, I will empower the person to then go back out so that they can be able to manage their problems.
And then I would assume too, from an ethical standpoint, you would not be able to see
can't.
right.
No,
You cannot.
I
right.
can't do that.
That's
I
it.
can't do
That's it. That's it.
Yeah.
So it's a lot of different variables in there when you're in the medical field. The oath for the confidentiality and all of that. There are certain things that you cannot you cannot do. Dr. Wallace.
Oh, the
Before you-
symptoms.
Trudy,
The
you mentioned
symptoms.
her
Yeah.
Yes.
What do you tell the physician that you're experiencing,
Okay.
or what is critical that you mention?
So someone who suffers their anxiety disorder, it's categorized as anxiety disorder, but there are different conditions which fall under anxiety disorder. So you have things like social phobia, that's social anxiety disorder. You have things like panic disorder. You have specific phobia. You have generalized anxiety disorder. You have agoraphobia. So all these conditions fall under the anxiety disorders. Okay. Now, if someone, and they all have their specific
Symptoms.
symptoms,
Okay.
right? But generally, someone who suffers from an anxiety disorder, they will have, most of the times, they will have panic attacks. They will have panic attacks. And what you'll find happening, the person will have chest pain or chest tightness, shortness of breath. They'll have a choking sensation of breath. They'll feel lightheaded. They may have tingling or numbing sensations in their extremities, tremors, sweating hands and feet, abdominal discomfort, and lightheadedness, difficulty concentrating. You understand? So that's what you'll find in someone who has a panic attack. And if you have this happening frequently, sometimes it happens without any precipitant. It just comes on without any trigger. You understand? And the person will be constantly worrying that they may have another panic attack. And more they worry, that precipitates more panic attacks. Now, that's in generalized anxiety disorder. If you have social phobia, social anxiety disorder, the person will have fear of going out in the public because they'll feel that people are looking at them and talking about them, saying things about them, looking at how they dress, how they look, fearful that they may make mistakes, fearful that they may be judged. So these are some of the things that will happen if someone has social anxiety disorder. No, specific phobia. I have this. So I do have anxiety. Specific phobia is when you're fearful of, not only fearful, it's not just anxiety disorder, is not just fear, but it's irrational fear. Having a fear of something, but there is no rationale to the fear. You understand? So you see a snake, for example, and when you see that snake, you just feel like that snake is going to attack you. That snake, you're going to have more than one snake. You just see one, but you're saying 50 and more just crawling up on you, coming after you. That's not happening, but that's what you're perceiving. And that is what that causes the anxiety. So you have specific phobia where you have fear of different things, different animals, who's fearful of cockroaches, fearful of heights, you know. Then we have agoraphobia, where is the fear of being in a closed space or being in an area where you'll not be able to escape in the event something occurs. Even sometimes in a wide area, and the first thing you look for is an escape. You're there, but you're scanning everywhere to see where can I escape in the event something happens. Nothing is going to happen, but the first thing you think, something might happen. And if something happens, I want to be able to escape. And you spend a lot of time trying to find that route, and you're just getting anxious. You cannot settle. You're very restless. So this is what you see in someone who has anxiety disorder.
We have a caller. Let's take this call. Good morning to you, caller. Thanks for calling.
Good morning.
Good morning.
Good morning.
Yes, Dr. Wallace just kind of took me to call because, all different conditions speaking about, he spoke about the sort of symptoms that kind of took me. In the symptoms that you call there.
Can you speak closer to your phone? We're hearing you a bit far.
All right, I am sitting with my phone. Hold on a second. Let me change the condition there.
Yes.
Okay, am I there
That's
now?
much clearer. Yes, it is
Okay,
clear.
so what happened? I was using my speakerphone because I'm multitasking.
Okay.
Okay, so Dr. Wallace named the set of symptoms there that just give me a flashbulb memory of a patient back in the couple of years ago who exhibited quite a few of the symptoms that she's talking about. And the person they thought that the person was crazy or mad or psychotic. And after a long while, for years, treating that person for whatever mental condition, the person actually had hypothyroidism. And yes, and why I picture it because hypothyroidism has a lot of symptoms that you just mentioned. That's why it flashed in my mind. Because I had hypothyroidism at one point, and I went through many things, but because the panic side of it, I didn't go because I knew something was going on, and what was going on, I didn't panic about it. I don't know, is something going on? The doctor cannot find it. Many tests were done. They could not find it until when I went to a search engine and symptoms brought me to hypothyroidism. I went back to the doctor and asked him if through all the blood work he had done that he would have seen hypothyroidism. He said no. So we have to do a hypothyroidism test. And then when we checked, it was hypothyroidism because it was correct. But with that particular lady, for years, she was treated for some psychotic problem. And then it came back full circle that it was hypothyroidism she had. So in your experience, Dr. Wallace, would you, or in your expertise, if somebody is showing all the symptoms and it's hypothyroidism and not something psychotic, would you tell or can tell the difference? I'll listen on there.
Okay. Yes, this is a wonderful question. It's a beautiful question, actually. I'm not sure how far back you went and where that person was, but one of the things that we are aware of, and I am aware of, is that there are a lot of medical conditions that do present with psychiatric symptoms. And whenever I see someone, I can speak for myself, whenever I see someone, I knowing that there are other medical conditions that can precipitate those symptoms, I always investigate to see if that person suffers with that medical. So as you rightly said, someone who has hypothyroidism can manifest with symptoms of mania, can manifest with a lot of anxiety symptoms. Someone who has hypothyroidism can manifest with depressive symptoms, and you may think that they have a major depressive disorder. There are deficiencies. There are different deficiencies that
Nutritional
do
deficiencies, yeah.
manifest also with psychiatric symptoms. So I'm aware of those things. As I said, I'm not sure where that person was or who was treating that person, but this is definitely something that I am aware of, and I always investigate whenever I have
And
patients.
always remember that the psychiatrist is also a medical doctor.
Exactly.
So that's why
exactly.
they'll be able to do all of that as
Right.
well. Let's take this other caller too.
No, that's me again. I just say thanks for the answer, but at the same time, what was going on at the time it was going on, I don't think you were part of that system.
Okay.
Yeah, but no, it's true because it's something that has been going on for maybe within the past 18 years, 18 to 20 years. And the lady, I knew her to the point where she even used to pull out her hair, and she had lots of hair. But with the hypothyroidism, you would get that too. So she did, but she was psychotic. But really and truly, I don't think that was during the time that you were in the system. You may be studying, maybe you're going to school still. But I want to thank you for your answer and your intervention, because to say that you actually take it from that perspective, because people rush to judgment so easily when they see certain behaviors. And because I know a lot of stuff, and I myself had gone through a period of hypothyroidism, and what triggered it at the time, I knew what triggered it, and I corrected it, not even with medication. So I just wanted to put that on the table. Have a good day.
Thank you.
Thank you.
Dr. Wallace, I want to talk a little about, for example, a patient would have seen you, whether it's at the hospital or in your private office. You've given that patient a diagnosis. I know when I was diagnosed, it took about 2 days for the psychiatrist to tell me, well, you suffered with that particular depression. And so sometimes it could be about a day or two or so. But when it's done, you've given that patient that diagnosis. And what happens if the client does not accept the diagnosis to the point where they don't want to accept treatment? How do you now help them to cope with the symptoms that they're experiencing? Because I know it happens a lot.
Yes.
A lot.
Carlton, that's a serious problem, because just like moving away, I'll go back to your question. Someone who is dependent on alcohol, for example, and everybody is telling that person, you have a drinking problem, you need to stop, the alcohol is affecting you, and that person does not accept that they have a problem with alcohol at all. You know how difficult it is to treat that person? Treatment starts when the person accepts that they have that condition. It's not any different with the mental disorders and even medical conditions also. Some persons are diagnosed with diabetes and they will say, I don't have diabetes. This is not diabetes I have. And no matter how much you try to show them the evidence, they will say no. And when that happens, they will not take medication. And then the condition just worsen and the situation, they just deteriorate. It's not any different with mental illnesses where I have patients and I'm telling them, this is what you have. I have treated, this is very common. I am treating this all the time. I know this is what it is. And you need to take this. This is what you need to do to get better. If the person sees me in my office, I will prescribe the medication, or even at the hospital, we'll prescribe the medication. We try all kind of interventions. Sometimes we even bring in family members. And if the person decides, no, I don't have this, I'm not going to take it, they will not take the medication. And this condition will just deteriorate and it worsens. So yes, this is a serious problem, Carlton. Sometimes what I try to do is try to use their life experiences. I said, but look how this is affecting you. In other words, try to get them to find something and to motivate them to stay well or to get better. I'm saying right now, this is happening. And because of this, you cannot relate with your children. Your wife is ready to leave or your husband is ready to leave. Is this important to you? You know, if this is important to you and you really want to keep them, I'm telling you, this is what is contributing to the problem. Is that enough motivation for you to want to get better? Is that enough motivation for you to want to be well? I have patients who come in with alcohol dependence and they have complications as a result. Some of them neurological complications, or they have cirrhosis or any of those. And I say, but the alcohol is killing you. It's damaging your brain. It's damaging your liver. What else do you want? If you continue to take this, you're going to die because it's just killing all your organs. Sometimes it takes something really serious like this to stop them, to stop patients and recognize, okay, it's true. If I take this, I'm really going to die because look what is happening with me right now. So sometimes it takes something drastic to get someone to accept that they have this condition and it's affecting them. For example, also major depressive disorder. Someone may be depressed and they say, no, I don't have depression. This is not what I have. But the person keep going in and out of the episodes, very sad, very low in energy, feeling very hopeless, withdrawn. The things they used to enjoy, they stop enjoying them. They no longer socialize. They lose appetite. They cannot sleep. They feel very negative about themselves and negative about everything around them. They cannot make decisions. They can't function, but they don't have depression. You cannot go to work because you cannot function at work. You cannot function in your family because of the way you feel. You cannot do anything at home. You're just in a room, in an enclosed, dark space that you want to do nothing. Now, you lose your friends. You no longer socialize. You no longer interact. Look at all the things that are being lost. Your friends, your family, your job, everything. Is that enough to motivate you and to encourage you to get help? So you try to show them, look at what is happening to you. And this is because of this condition. So let's do something about it. Try to work on it. Let's try to manage it so that you can start relating again. You can start being productive at work. You can keep your family. You can make important decisions, you know. So these are some of the things that I try to do to help.
Doctor, once again, two things. Someone who is maybe going through mental illness but is still able, one of the things you just mentioned could be motivating to them to seek help or to accept a diagnosis is the inability to function or losing family, losing friends. Somebody may be going through a mental illness or experiencing a mental illness but functioning still. What then would be, the motivator in that instance? The person is still able to keep that high level job or that job. The person is still, but the interpersonal relationships are maybe suffering. Other things are suffering, but the sustenance, which is the job, they're still maintaining. So what can be the motivator there? And yes, let me ask that one, and then I will leave the last one for last.
So I want to say, having a mental illness does not mean that you cannot live a normal life and you cannot have a job. The conception is that if you suffer from a mental illness, you will always have poor mental health. That's not the case.
False.
It's false. And sometimes if you don't have a mental illness, you'll always have good mental health.
That's false.
That's false also. You understand? So you could have a diagnosis of depression. I'll stick with depression. You have a mental illness called major depressive disorder. But if this is being managed, you will not have the episodes. You understand? And you will have good mental health, even if you have a diagnosable mental illness. You understand what I'm saying? So remember, just like the other medical conditions, you have a major depressive disorder, but you have episodes of relapse.
Okay.
You will not be depressed throughout your life. Yeah. And so the times that you are not in a depressive episode, you will be able to function.
Okay.
It's the time that you're going through an episode, that's when you'll not be able to function.
Understand.
Okay.
It's not throughout at all.
Okay.
Someone who has bipolar disorder, bipolar 2 disorder, for example, the person will be between a depressive episode and a hypomanic episode. When the person is in a hypomanic episode, the person can function and do everything. In fact, that's when the person is most productive.
Yes.
The person will have a lot of brilliant ideas, industrious. The person will be full of energy, will be able to take on different jobs, do different things. And it's likable because with someone, when you have bipolar 2 disorder in a hypomanic episode, people say this as how, it's normal and they enjoy being around you because at that time, you bubbly,
yes.
and everything. You're full of energy. You like the life of the party. People enjoy your company. It's when you're in the depressive episode, that's when you'll have problems functioning. You will dip and you'll just be flat, not have any energy, not be able to get up, not be able to do anything at all, feeling very hopeless, all the symptoms I presented earlier. But the person has a person has bipolar disorder, but in the hypomanic episode, they can function. You understand? So remember again, and I keep every condition has its symptoms and it's manifested in a different way. Everyone requires a different management. Some of them may not require medication. Some of them is just psychotherapy, and others and on medication. That's another thing that I remember I said earlier. The treatment depends on the condition you have, the intensity of the symptom, and what works for you. So the medication, one medication may work for me, it may not work for you. You understand? So you have to know yourself. You have to know your body. You have to communicate all those things to your doctor. You have to, in other words, pay attention to the symptoms, pay attention to how your body responds when you take a medication, if there are any side effects, and communicate those things to the doctor so that both of you can work together and make changes to the medication. Don't stop it on your own, because stopping it on your own is going to cause problems.
I just say it's not working.
And another thing, I always, when it comes to the antidepressants, they don't work immediately. They take time. At least 3 to 6 weeks before they work. And you might see changes after about 10 to 12 days, but it takes about 3 to 6 weeks. So you have to take time. This is something that you have monitor the progress, and communicate all those things with your doctor. And the antidepressant that works for me may not work for you. So sometimes we have to keep changing them until we get the one that works for you. So it, again, as I said earlier, it depends on what works for you.
As we close, Doctor, we have just about 4 minutes. I wanted to ask you, because we're talking about coping, how can families help their loved one who would have gotten a diagnosis and is on treatment to cope beyond just relying on the medication?
If there is.
Yes, to cope with the disorder. Some of these disorders, you may have them for life. Some of them may be for a period of time. But how do you get family and friends to help this person to cope?
All right. So first of all, important is to accept that you have this condition. Okay. Once you've accepted it, it will be easier for you to do whatever is required to do. When it comes to families need to also not discriminate against someone when they have a mental illness, someone who has anxiety disorder, somebody who is depressed, or someone who has difficulty coping, an adjustment disorder. Don't see the person as being weak. You understand? And don't say all these negative things to them. Recognize that they have a condition that is diagnosable, and that's the reason that they are manifesting those symptoms. In other words, they need to be more supportive. So family members also need to make the extra effort to try to understand what's happening with their family member, what's happening with their children, what's happening with their spouse. Try to understand what is going on, learn about the condition themselves so that they too can be able to identify the symptoms. They can be able to identify the triggers, and help them to cope when they have difficulty coping. If it requires medication, help them to remember when they have to take their medication. Make sure that they always take their medication. And don't see them as different. Don't see them in a different way. Having a mental illness, whichever one, does not change who you are. You are not the mental illness. You are a person who is suffering from a mental illness that can be managed and can be treated and has nothing to do with you. It's not you and the mental illness in one. You understand what I'm saying? Okay, so family members need to do that. Pay more attention and be more supportive. You understand? Help but it doesn't, although you ask about family members, but the person themselves has to recognize that they are not alone.
True.
They are not alone. They are not the only person suffering with this. There are many other people suffering with this. And even in that home, they can share. When you share with someone, it gives the person the opportunity to help you, because suddenly I have something on my mind that's bothering me. I'm keeping it. I'm not sharing it with anybody. It's only me dealing with it. The minute I share it with you, suddenly it is shared. I have 50%, you have 50%. And it's two of us now working with it and trying to get a different perspective. You may have a perspective on something that I never thought of, and I could use this, and this could help me to cope with whatever it is that I'm coping. So we need to communication is important. And family members can reach out a bit, to help and encourage a person to communicate a bit more.
You mentioned quickly too earlier on about you seeing many young people coming to the unit or you having to intervene. What advice would you give to parents in terms, especially young school, high schoolers and college, students, in terms of what to observe in their children and when to seek help with their children?
Parents, I would like to really encourage parents to try to maintain a value system that you can pass on to your children. We are moving away from the core values that we need to help us to be responsible, respectable adults when we grow up. So parents need to pay a little more attention to this and look out. And you have to remember, as parents, your children are in your space, they are in your environment. What you do, what you say is going to influence and impact what that child does. So don't say that I am doing it, it's me. I don't expect them to do it. We are a product of our environment and our socialization. So what the children see happening in the environment, that's what they're going to continue doing. You understand? And the same thing, they're going to just carry it on out there. Now, look out for the signs. Be actively involved in your children's lives. Communicate with them. Make it easy for them to reach out to you. Make it easy for them to discuss things with you. And whenever, always ask questions. Always ask questions and be part of their lives at all time. And if you do, you will see it will be very difficult for something to be happening and for you not to recognize it. If you are actively involved, you always there, you will notice the little changes in them. You will notice them, but you have to be there from the beginning and paying attention to them. So you'll see the behavioral changes, you'll see the way they hide in something, you'll see that their friends may change, you'll see their mood may change. You'll see those things, and you'll see saying things or doing things that they were not doing before. Their grades will start dropping. All these little things are signs that, okay, something is going on. That wasn't happening before. I need to pay attention to what's going on, and for me to see what, to try to see where that difference is. What is infiltrating in that child, where it is, and to try to take it, to stop it from the beginning. So we need to pay more attention as parents and educate our children. We need to constantly be educating them. You don't only learn from your experiences, but also from the experiences of others. Let them identify with you. You were a child yourself. You went through those things. Sometimes we as parents, we are not real with our children. We hide things away from them, and they think that we never went through it ourselves, and they may be embarrassed coming to us. But if you're open with your children and let them realize, I was there myself. I was a teenager like you. I am not perfect. There were things that and this is what happened, and this is how I managed it. You understand? It would make it much easier for them to come to you if they have any of these problems themselves, because they'll know mommy can identify, daddy can identify. Mommy is not going to be judgmental. Daddy is not going to be judgmental. They're going to listen to me and they're going to help me.
Dr. Wallace, I want to wrap up with one on in that same line. Just my last question. At the start of the show, you spoke about risk factors. We're speaking about children. Are there any particular, just if you just have to name some things that can occur in the life of a child that require immediate intervention to prevent possible mental illness in the future? If you could just name a few, because I know our time is up, Carlton. Yes.
Actually, the first thing that came to my mind is sexual abuse. Child sexual abuse, emotional abuse, physical abuse, shifting, moving from one place to the next. You know, there's also, if a child loses a parent before the age of 12, that also increases their risk of suffering with major depression when they become older. The environment, if they see that conflicts are resolved with violence, they're resolved with aggression, guess what? When they go to school and they have conflicts themselves, what they're going to use? The very same aggression, the very same violence that they see at home, because they take those things as normal. When there is abuse between the parents, the father is abusing the mother, they see this, they grow up believing that this is normal. So they themselves end up going and, you know, being in an abusive relationship themselves when they get older, because it was normal. That's what they grew up on. The father is drinking alcohol and coming home and fighting. When they get older, they gravitate towards someone who also drinks alcohol. And sometimes they even believe that if the person does not beat them, it's not normal. They need to beat them because they equate that to the person loving them.
Yeah.
So your environment, all these things, your environment, what happens in your environment, and what we teach our children, the abuse that our children go through. Oh God, I'm saying this too much, especially sexual abuse. A child is abused and that child grows up not having any value. That child look at themselves like as being worthless, not having any self-worth, having low self-esteem, not being very confident, not being able to trust anybody. And it happens when they get older, they can't have long-lasting, meaningful relationships. The relationships are very superficial. They have difficulties when they have their partners. They will not be able to trust their partners. They will not be able to have intimacy with their partners, because during intimacy, they will be reminded of that abuse. They might see their father having sex with them, their uncle having sex with them, when, you know, at that time. So all those things, I see this happening all the time. Or they may have behavioral problems. They think that they're worthless. They're only good for sex, and they go out there just behaving recklessly and being very impulsive, engaging in drug use, you know, marijuana, alcohol, and just having these behavioral problems, or they're not caring and fighting easily because they don't think it's not worth anything.
Yeah.
Dr. Wallace, it was a really packed show. I do know, and I'm sure that many of our listeners. Oh, actually, there was a question somebody had asked me to ask you quickly. I know QFM has always been generous to us. It says here, can you please ask Dr. Wallace, how can someone that's hoarding get help?
Oh, water.
Someone who is hoarding, this is a problem. It happens in Dominica. It's not very frequent, but I've seen it. The person needs to be moved from that area for sure, and there is treatment for this. The person should not be left alone. The person should be with somebody, and that person should be almost like a sergeant, constantly monitoring that person and ensuring that they don't. But there is treatment for this, so the person will be placed on treatment.
So quickly,
and you have to.
Is hoarding a form of depression, or is a?
No, it's a separate condition.
Is it OCD? So it's a different
separate
condition
all by itself. Yes.
Oh, I
Yes.
didn't know that.
Yes. And you can see it also in schizophrenia. If the person has schizophrenia, you can see it many times in schizophrenia.
Mm. Okay, caller. So, Dr. Wallace, your number. Somebody might want to make an appointment. They might have
office,
heard
yeah.
you.
Yes.
The office number, your location.
My number is 448-8468. And my office is located on 28 River Street, Goodwill. That's right next to the Goodwill bus stop.
448-8468.
Yes, 8468.
Okay,
It's
so
on
if
River Street.
you want to contact Dr. Wallace,
So if
that's
that-
her contact number.
Mhm.
Okay.
Okay.
So, listeners, we had a very, very deep show this morning. I do hope that the contents would have reached you and that the information that you would have heard, you'll be able to share it with someone else and inspire someone, motivate someone to seek help when they do need that help. Thank you so much for listening to us on yet another episode of Health Vibes. As always, your health is indeed your greatest resource. Take care, everybody. Have a good morning. Bye-bye.
Bye-bye.
Easy Rock 95.1. More rock, less talk while you work. The latest soft rock, hit after hit. Tune into Easy Rock 95.1, the best mid-morning show in the game. Right here on Q95, the big station.
Great Father's Day promotions are now on at Eastern Trading Limited from now until June 17th, 2024.